We are live. Hello, humans. Welcome. Happy Friday. Dr. Sarah Happening here with Performance is Happening. And we help humans live happier, healthier lives with a specific focus on helping neurodivergents thrive in the workplace. And today we are super excited because we are doing another pre-conference conversation for the upcoming Art and Science of Health Promotion Conference that's going down next month in Colorado Springs at the Broadmoor, and you can still grab your ticket. The registration link will be linked in the description of this video. And today I'm so excited because I'm joined by Dr. Julia Pangalangan. Did I get it right? We practiced like 10 times and my ADHD brain is like, doesn't take verbal information in the same way. But I got it right, which is awesome. So she's a director of research and training for Paving the Path to Wellness at the University of Colorado Anschutz Medical Campus. Julia specializes in implementation science and whole person health, and her work focuses on helping lifestyle medicine programs move beyond theory into real-world measurable impact. She leads evaluation and training efforts for a neuroscience-informed group-based health program delivered across diverse clinical and community settings in the United States. Her research examines not only whether programs improve behaviors like nutrition, movement, sleep, and stress management, but also how cost, training, and administrative systems influence whether these programs actually scale and sustain. So I'm super excited to talk to Julia today because she takes science and actually helps to implement it to help humans live happier, healthier lives. So I'm so glad you are here, and we're going to dive in. So my first question for you is, you've worked across research, health coaching, product marketing, and now implementation science. What drew you to the whole person health work?
Yeah, that's a great question. I definitely started out my career working more at the individual level. So I was a personal trainer and health coach, and was really drawn to the ideas of positive psychology and how we can help individuals and communities thrive and pursue well-being. I quickly realized that not everyone has the same access to pursue a healthy life, and that there are different social determinants of health that may come into play and that have these broader community and systems level factors that are shaping their health. And it goes so far beyond individual choices and willpower and behaviors. And so that led me to my master's in community health and prevention research at Stanford, which really focused on community engaged approaches to health promotion. And from there, felt like I just had even more to learn. So pursued the doctorate in community and behavioral health, and have really gotten to dig into more of implementation science and understanding that there is this huge gap between health behavior and health research and practice. And that it's actually only 14% of evidence-based interventions for health research are successfully translated from that efficacy effectiveness trial into routine practice. And that's a huge miss. In terms of amplifying the impact of these sorts of evidence-based interventions in the real world, where they can make a difference for individuals and communities. So I've really stepped into this more whole person approach, and implementation science is just kind of that natural bridge of saying, we know these things work in a lab, but how can we get them to work in the real world for real people and make a difference? And so it's been a wonderful journey of kind of seeing all of these different needs and blending them together into a really fulfilling space.
That's amazing. And my brain immediately, I understand that, because putting theory into practice and what we can show in a lab and what we can show with research, but you get into an organization or working with humans who don't always act the way that science says that they do. What would you say, if you could give the cliff notes of bridging that gap really quickly, because you said 14%, it really only works in 14%. If you could give the cliff notes of what's like the secret sauce or the magic wand, and I know those are really trendy terms, but what would you say would be the biggest way that you can take that data and actually implement behavior change and have change happen in an organization?
Yeah, well, I think one of the biggest gaps is that most of those evidence-based programs that have been developed, or interventions that have been developed from efficacy or effectiveness trials, they focus solely or mostly on patient outcomes, right? While largely ignoring this external context that we know is going to influence whether it's successful in the real world. So I think there's this really big gap in actually systematically evaluating things like external context, these implementation determinants that are at play, right? It's not just the intervention, but it's the inner setting where it's implemented. It's the people that are involved. It's the external setting, then the climate in which it's implemented in. And so I think that the gap there is really, most people aren't even evaluating things like acceptability, feasibility, fidelity, sustainability, right? We're stopping at, does this produce the change we wanted in the patient, yes or no? So that need, I would say, is not the answer to your question, because then there's so much nuance and in what setting and all of these different other factors and for whom. But I would say that the gap or the secret is that we need to systematically be, first of all, even assessing implementation factors in the first place to understand that and uncover that secret sauce.
Yeah, no, I love that. Assessing where you are. I mean, this is always a thing with the humans that I work with as well. It's like, if you don't measure anything, how are you going to know you improve? Mm-hmm. And what is the goal? Because a lot of, especially with health and wellness, like if an organization has a certain amount of wellness dollars and they just want to spend them and they don't actually know what is the goal of this. Are we trying to increase productivity? Are we trying to reduce stress? Like all of it. I mean, anything you do is going to be great, right? But once you measure something, then you can assess if it's actually working or not. So I think that is key. And that is one of the things that we always talk about is like, what's the goal here? What are we measuring? How is this going to work? Mm-hmm. Okay. So for someone who doesn't know or hasn't heard of Paving the Path to Wellness, can you tell us what it is and who is it designed for?
Yeah, Paving the Path to Wellness is a lifestyle medicine program. So lifestyle medicine uses therapeutic lifestyle intervention as a primary modality to prevent, treat, and reverse chronic disease. It's a big aim, and Paving the Path to Wellness is one of the wonderful programs within that realm. So it's a nonprofit that was started by Dr. Beth Frates over 12 years ago. It was originally developed for stroke rehabilitation patients, but has since been adapted to a variety of patient populations. So we have a big breast cancer presence at Mass Gen with Dr. Amy Commander. We've worked with a lot of perimenopausal populations and kind of everyone in between, anyone who is looking to prevent, manage, or reverse chronic disease. So Paving is a primarily health education program that integrates peer support and is facilitated by a trained healthcare provider. So it can be offered in person, it can be offered virtually. It's going on in different healthcare settings across the country and even some internationally now.
Oh, I love that. Good job. Good for you.
It's not me. Yeah, no, I got joined with Paving during my dissertation work of my doctorate, and they had been up and running for a while and just needed someone to bring a little bit more of a research lens to it. So I've gotten to come on board as kind of a research and evaluator, and then also kind of scale up our training program so that it is tailored to more than just physicians. We now train NPs and PAs and OTs and PTs and all the allied health professional acronyms that you can think of. So yes, it's been a wonderful experience.
Yeah. You're more on the like implementation science side of it, which sounds cool. Mm-hmm. For those listening who aren't quite sure of what implementation science is and why wellness leaders should care about it, can you tell us a little bit about that?
Yeah, implementation science studies the systematic uptake of evidence-based interventions in real-world settings. So again, it's thinking of that idea between closing this gap between research and practice with systematic approaches, theories, frameworks, and models that can help people bridge that gap to continue to deliver, scale, and sustain evidence-based programs in real-world settings.
I love that. So what I tend to see a lot, or especially when they're taking research and trying to implement it in the real world or in organizations, there's an assumption that everyone can kind of engage in the same way. And this is a personal question for myself because we deal with neurodivergent so much. But based on your findings out of the research that you've done, have you find that anything needs to kind of shift in program design, or maybe even like in the implementation, to better support people who might struggle with things like focus or organization or stress regulation or us neurodivergent types?
Yeah, that's a great question. One of the biggest things that has come out from our implementation research, not just with PAVING, but at the University of Colorado, Anschutz, I'm a postdoctoral fellow, so I work on a couple of different well-being focused projects. So we have the WELL program is a mental well-being program in early childhood education, and we've done a good amount of implementation work there as well. And one of the factors that emerges time and time again is leadership engagement. How engaged are these leaders with this well-being effort? How are they speaking about it? How are they, ensuring communication channels are getting to who needs to hear about it and who can engage with it? And so I think thinking first at the level of the leader is super, super important. But then within implementation science frameworks, there's like an individuals and a characteristics domain. And that looks at the need, capability, opportunity, and motivation that individuals have to engage in a certain intervention. So I do think it's super valuable to think about those different individual characteristics and how those might be coming into play, and making sure that the intervention and the implementation strategies are tailored to the individual and the community where you're trying to implement it. So if that's the workplace, right? Like, how is this intervention being tailored to the specific health needs, the motivation and interests of the employees at that place? And what can we do to change different elements of the intervention design to make it more accessible, to make it more appealing? So I think that, again, there's never going to be like these gold standards. This is the best way, because it depends for who and in what setting and what the outcomes are, to your earlier comments.
Yeah. No, I love that. And I hear it time and time again. It's like, here's how theory works. But at the end of the day, talking to the human as the leader or as the organization, being like, what do you need? What's going to work? What's the goal? But having that, taking the data and taking the science and having the conversation with the human and looking at the culture of the organization and everything, and being like, how can we implement what we know in real life? Do you find that there tends to be a lot of resistance there when you're trying to show data, show science, be like, here's how it works, but we still have to humanize the experience and make it kind of individualized depending on who's showing up, who's there, like what the organization is?
Yeah, and that's where there's a really interesting conversation around adaptability and fidelity come into play. So adaptability is how we can change this intervention to fit all of those things that you just described. Can we change the modality that it's offered in? Can we change the content a little bit so that it's more relevant to this community? Can we change the imagery so that it resonates more with this population? Those are kind of pieces within adaptability. How adaptable is this intervention, while thinking about fidelity, which is keeping to the core components of an intervention that made it successful, right? So what is it about PAVING, right? The health education, the peer support, the facilitation by a healthcare provider, that are those core fidelity components that shouldn't be changed because it may change the impact of the program. But within that, there's so much room for adaptability of the types of questions that we ask, and the time we spend in group discussion versus lecture, all of those sorts of things that can be adapted to better sort the population. So I feel really grateful that my background comes from a community engaged research space. A lot of implementation scientists are a lot more clinical. So I'm very grateful for the background in community engaged research, because it asks all those questions that you just said, that we know that the community members are actually the experts in their own well-being, and they know best what's going to support their health. And it's not our job to come in and deliver this cookie cutter program or intervention or workplace, well-being offering benefit. But it is our job to be that active listening ear to see what the community needs to be successful, and then think about how we can adapt that evidence-based practice to support that community.
I love that. That's awesome. Shifting more, well, I guess it's not really a shift. From a leadership perspective, if you're going to be going in and designing a group-based well-being program right now, what what do you suggest a leader should prioritize?
Yeah, definitely the time and costs associated with the intervention, right? So if the employees don't feel like they have the time or capacity or support to participate, you're not going to see that meaningful engagement. So it's up to the leader to say, hey, this is a priority of our organization. We care about your well-being, and we're carving out this, hour a week for it, or 20 minutes a day for this mindful, whatever the intervention itself is, and whatever carving out the time looks like. But around implementation science, a big conversation is identifying and addressing the barriers and facilitators. So as a leader, thinking about what might be the barriers someone has to participating in this intervention, and how can we reduce those? So it's typically time and cost that are the highest from like a leadership to thinking about their patient population or employee base.
Mm-hmm. Yeah. And I don't necessarily know what the answer is, and we can chat about it. But when someone's overwhelmed at work, and I love when organizations will allow employees to take the time at work. A big part is we feel like if we're doing this, we can't do this. And it's really sad that wellness and health is usually lower on the totem pole. But what I'm really passionate about is getting it to the top of the totem pole, because if you take care of your health and wealth, and everything's going to, not health and wealth. Sorry, it's Friday and I was in Hawaii last week, so I'm getting back into life, and the brain needs some more caffeine. Health and wellness to prioritize, so that then an employee or a human who feels better is going to do better. It'll be easier for them to focus. They'll be more productive. They'll feel better at work. Their mental health will be better. I mean, I'm preaching to the choir here. We don't need to. But is there anything that you have discovered, whether it's like communication, or I know a lot of it also can be leaders showing by example of whether they're participating in certain health and wellness things at work, or giving employees a specific time, like every day, or here's however many minutes or an hour that's just for you. That time thing seems to be such a big resistance. Do you have any keys or takeaways that you can share with the audience about that?
Yeah, I mean, I think it definitely depends on the intervention itself, right? But I think thinking through time and what's conducive to producing that behavior change. But it goes beyond time, right? Like time is one aspect. We need that physical time for participants or employees to engage. But to see actual behavior change, we have to move across this spectrum. So I'm thinking of the theory of planned behavior, right? That says that our social norms, attitudes, and self-efficacy shape our intentions to set goals, make changes, see that health behavior change, and ultimately those health outcomes that we're looking for. So if you think of like the workplace, we have to have the time. That's just a baseline. But then how is the culture of the workplace setting positive attitudes towards that health intervention, whether it's mindfulness, stress reduction, whether it's physical activity or nutrition? What are the social norms in the workplace? What types of foods are we catering? Are we taking moments of pause before meetings? Are we prioritizing any of the things that we're preaching in this intervention, right? Like, what's the culture saying, and how is that shaping attitudes and social norms? And then the self-efficacy piece, right, is like, can I do it? Can I make that change? To how confident do I feel in living that healthier life or taking that next step? And I think that's where the intervention can take place. But thinking that it's so much more than just participation in the intervention when we get to these real world settings. It could be the most effective intervention in a controlled setting, but if it gets into the workplace and the attitudes of the colleagues and the social norms around nutrition or stress or sleep or whatever the intervention is are negatively impacting it, we're not going to see those outcomes that we want.
Yeah. Going back to the whole humanism of, in theory, everything's great in theory, but in practice, it is very different.
Yeah, we could see those great increases in knowledge from a workshop. But how are they going to put that into practice if the workplace isn't supportive of that with shaping positive attitudes and social norms towards whatever it is?
Yeah. So can you tell us a little bit first what your session is about? And what do you hope that people who come to your session, they leave with?
Yeah, that's a great question. One of the reasons that I submitted for this session is that with paving and through my dissertation work, I recently completed a pilot hybrid study of the paving program. So looking at its preliminary signals of effectiveness for health behavior change, but also those key implementation factors that we've kind of been talking around in this conversation. And so I think that the goal of the session is to really get people thinking, who do they serve? What outcomes are they looking for? And how can an understanding of implementation science help get them to close the gap between research and practice with whatever the outcomes are at their organization? So we're giving the kind of a specific example of the paving program, which was implemented in different clinical and community settings across the country. So we do have a pretty heterogeneous population to look through, to think through some examples. And then we'll identify some of the specific barriers and facilitators of implementing that program specifically to hopefully open a broader conversation of what are the barriers and facilitators at your organization? How are they operating at these different individual, organizational, and systems levels? And what could you do in your workplace to help close that gap and see the behavior change or the outcomes that you're looking for? So I think regardless of industry, I think implementation science is so widely applicable. I'm hoping that there's a lot anyone can take away if they're at the more workplace wellness level or research. I think that there's so much we can learn from implementation science.
Yeah, I think that's awesome. I think it's going to be a really great session because I personally had a lot of resistance because my background is also in academia, but similar to you, like I worked with humans. I've been a coach for 26 years and taking science, and it's more than just putting it into practice. So I think by attending your session, you're going to have the steps, what it sounds like, because you said we're going to do it in all sorts of organizations, regardless of your level or what your role is, to take what data says and be able to say, here's how this would work in my organization or at my place of employment. And I think that's so important with also, and I know you're going to incorporate the humanistic perspective because we are humans, right? It's not just, we don't fit in a box. There's so many other things going on. My background is in psychobiosocial, so that's why I look at like the holistic human. But if you guys are coming to the conference, you need to be at Julia's session if you work anywhere, if you care about humans, if you want to take data and actually be able to apply it to make real behavioral change. Because what I'm hearing is there's whole human perspective, and regardless of like what's going on, it's more than just one thing. Like we always think, and one of the questions I asked was like, what's the magic wand? And everyone wants a magic pill and a magic wand and no work, but I know it's going to be more than one thing. And I think by attending your session, they're going to have steps and ideas, and it sounds like you're going to teach them how to implement this stuff. So I'm excited. I'm going to be there. Do you know what time it takes place and what day?
It's Wednesday. I believe it's 3:30, but I would double check.
Okay, perfect. Yeah, there's a schedule out there linked on the website that I linked in the description. So Julia, thank you so much for being here. That was fun. I'm so excited to learn more and attend your session. And my session is going down Thursday at 3, or I think 3:05. Thriving with Neurodivergence in the Workplace. So if you are attending with us at the Broadmoor, we would love to see you at both of our sessions, and have a beautiful week. And thank you so much for your time today, Dr. Julia.
Yeah, thank you so much. This was great.
Beautiful. Yay. And